So let's move on and talk about gallbladder disease. Another bad development, I think, in medicine has been this cavalier attitude that if a body part's giving you trouble, we just take it out. They're very cavalier about removing body parts, and I think you should hang on to your body parts, as many of them as you possibly can. So in spite of that, there are 800,000 hospitalizations a year for gallbladder disease, and most people have some gallstones. They don't necessarily cause problems. Women are more likely than men to develop them. 50% of women over age 70 have some. A gallbladder attack, which you probably have heard of, leads to hospitalization, trips to the ER. This is when the cystic duct, which carries bile to the small intestine, becomes blocked. It causes incredible pain in the mid-upper or right upper section of the abdomen, can involve the right shoulder. It can radiate all the way up to the shoulder. Nausea and vomiting are common. It can last for up to 6 hours. Inflammation and bacterial infection can result. The treatment is antibiotics and removal of the gallbladder, and it almost always occurs again if you don't do something about the underlying cause. So what the cycle will usually be is a couple of gallbladder attacks and then the advice to remove the gallbladder because there's nothing you can do about it. Well, there's a lot that you can do about it. More than 90% of gallstones in westernized countries have high cholesterol content. Well, where's the cholesterol coming from, folks? It's not coming from broccoli. Let me give you a clue. When bile fluids in the gallbladder become oversaturated with cholesterol, solid crystals form, which can eventually develop into stones. Diets high in cholesterol-containing foods, main cause of this. A diet high in the intake of plant fat can also cause it because the liver produces more cholesterol-containing bile. And this is why you hear people like Dr. Esselstyn talking about the fact that you can't eat a high-fat diet and replace plant fat for animal fat and end up improving your health. First of all, you're not going to lose weight that way, most of you, by continuing to eat this calorie-dense food. And something I think needs to be said about this, and I talked about it a little bit yesterday, but a cup of avocado has 21 grams of fat. A tablespoon of oil has 120 calories and 14 grams of fat. People eat 50 grams of fat on their salad and then say, I can't understand why the weight won't come off. And my cholesterol is still high. Gosh, I wonder why. So the substitution of plant fat for animal fat is not a good idea. I'm not suggesting that people never have fat at all, but I'm suggesting that if you're eating oil and avocado and nuts and a lot of those foods with a lot of regularity, you're going to have trouble with weight and you're going to have trouble with health. This is evidenced here. A low-fiber diet contributes to gallstones because slow movement of the contents through the intestines results in reabsorption of some of the bile acids. A high-fiber, low-fat diet helps to prevent gallstones. There's a direct relationship between the amount of fat in the diet and gallstone formation. So I mentioned most people have some gallstones, and most of the time they don't cause pain or symptoms, and they're often discovered by accident when getting an image for something else. 80% of the time they can be left alone, and they're best left alone because the risk of surgeries sometimes, most of the time, outweighs the benefits of removal in asymptomatic people. People who are diagnosed accidentally, however, are often told incorrectly by their doctors that this will develop into cancer if they don't have their gallbladder taken out. You want to avoid surgery for gallbladder if at all possible, and here's the reason why. When the gallbladder is removed, there's no storage area for bile acids, which means that the bile acids drip directly into the large intestine. This can cause irritation, diarrhea, and increase the risk of colon cancer. Here's the other thing. 35 to 40% of the time taking the gallbladder out doesn't change the symptoms at all. And I have a friend who had his gallbladder taken out because his physician advised him to, and he is just as uncomfortable today as he was the day before he had that operation. And it hasn't gone away. In fact, it gets worse. The risk of cancer on the right side of the colon is higher for people who've had their gallbladder removed. Remember, that's the hardest place to get an image. So this is a great way to end up with colon cancer. An optimal plant-based diet, very low in fat, can resolve gallbladder disease and eliminate the need for surgery most of the time. In fact, one of the things that we'll sometimes do is when people are scheduled for gallbladder surgery and call and say, I'm getting ready for surgery, what should I do to make sure this doesn't happen again? And I'll say, well, why don't we do this? I know your surgery is scheduled for 2 weeks from now, so how about we adopt a really low fat plant-based diet? A good portion of the time people cancel the surgery because they're completely asymptomatic within a short period of time. And I love people with gallbladder disease, and I'll tell you why. They only have to eat one high-fat meal, and they're back to being in excruciating pain, and they never do it again. They are among the most compliant patients. And you remember I mentioned yesterday about the flaw in the design of humans where your arteries don't have any nerve endings so you can abuse yourself for a long time? Isn't that a shame? Because if there was some big warning sign every time you ate something horrible, we wouldn't have to have conferences to talk about this anymore, would we? Because everybody would get the warning sign. Just like you put your hand on a hot stove one time, you don't do that again on purpose, right? Okay. So that's why we have to approach this from an intellectual standpoint. I've talked to a few of you in between sessions and that sort of thing, and I enjoy that kind of dialogue a lot. But I try to talk you out of this idea that you're going to see how you feel after eating things. A lot of the people in my office didn't feel bad at all after eating a lot of high-fat food until one day their gallbladder started screaming at them, and then they know that they have a problem. So you've got to look at this from an intellectual standpoint and start making your decisions based on what makes sense.